Hi, I am Dr. Suvarchala. I am the Scientific Director at Ziva Fertility Centers. What causes infertility? Is it just the female? Is it just the male? Or is it both of them together? Very important cause for ovulatory disturbances is PCOS. You must have heard about it. PCOS or PCOD or PCO, Polycystic Ovarian Syndrome. Now, polycystic, the word itself is self-explanatory. In the ovaries, there are many cysts inside. So these are just filled with fluid. We don't know which one has an egg. Imagine a room full of wrestlers. Now you want one of them to come out, but they're all wrestlers, they're all strong. All of them are fighting and none of them are released. So the same thing happens with polycystic. So many follicles are growing that none of them are capable enough, or should I put it this way, they're all strong enough and they don't share the hormonal signals that are coming to the follicles. So none of them is able to achieve ovulation, that is, they don't get released for ovulation to happen. So this is a very critical thing. There is a status quo, they are all growing, they have a very distinct pattern of follicles all around the ovaries, and there is a physical manifestation of PCOD as well. There could be prolonged gaps between periods. There could be hirsutism, so there is a lot of hair on the body, the face, the hands, the legs of the woman. There could be weight gain because there is an imbalance in the body. There is a lot of male hormone produced, testosterone, and that causes hirsutism. There is a lot of imbalance in insulin and metabolism that's happening in this woman, PCOD woman. So there is a problem with that as well, and that causes weight gain. That causes irregular cycles. There is a lot, like I said, there is there are physical manifestations as well. The problem is not just this. The problem is also that PCOD woman never gets to know when to try. Her periods are so far and in between, so irregular, that she never gets to know when his egg is ovulating. So she never understands when the right time is for them to try. So that's one of the reasons. Next, if you look at the next part of the body, the tubes, tubal blockage, it could be unilateral or bilateral. It could be some infection in the tube which is causing this, and the infection is also causing backflow of this fluid. So that could be another reason as well. There could be previous ectopic pregnancy, so that ectopic pregnancy could be causing the infections in the tube, or there could be damage inside the environment of the tube which is causing maybe the egg is not able to transport itself, or its sperms are not able to reach the egg because of this infection. So that's one of the causes as well. And when we look at the uterine factors, the reasons could be many. It could be a congenital anomaly. Like I said, a part of the uterus could be missing. The connection between the tube and the uterus could be missing. The connection between the ovaries and the uterus could be missing. So the anomalies are of various kinds. Then there could be fibroids. Fibroids are outgrowths of the muscle of the uterus inside the endometrium, inside the part of the uterus where the baby is expected to implant. So fibroids could be a cause. There could be endometriosis. Endometriosis, another topic in itself, but it's tissue which is basically shed every month. Endometrium, isn't it? So endometriosis is a phenomenon where this tissue grows in various parts of the the organ, ovaries. It could be on tubes, it could be on uterus. So every time you have periods, that part also sheds and there is extreme bleeding. And if this is present inside the uterus, this causes severe damage to the environment of the uterus where the embryo is not able to implant. So the reasons are many, and to reach to a conclusion takes time, but you need to be patient when you are going for treatment for infertility, because we need to come to a conclusion what could be the reason, and it could not be just one, it could be multifactorial. Maybe you have all these factors with a factor in your husband as well. But the good news is that there is a solution to every problem that I talked about. We can either bypass or rectify the problems that are there and achieve a successful pregnancy. You need to know more, you want to understand more, you want to you've already had investigations that you want us to look at. Please feel free to leave a comment or take an appointment on the numbers that you see on the screen and get in touch with us. Thank you.